Your rabbit keeps picking up a pellet, then dropping it, then trying again, and you are not quite sure why. Maybe it is eating a little slower than it used to, or leaving the harder bits behind. In Singapore, that small change is worth a closer look. So let us talk about teeth. Important note up front. I am a fellow Singapore rabbit owner, not a vet, and I cannot diagnose your rabbit's mouth from here. What I can do is help you notice the early signs sooner and get to the right person faster. So this is a what to look for and when to go video, not a fix it at home one. Every sign I mention is a reason to book a vet, never a thing to treat yourself. Here is the plan. How rabbit teeth actually work, why dental trouble is so common, the early signs owners tend to miss, the difference between front and back teeth at a high level, why you must never file teeth yourself, what a good vet does, and the diet that protects the whole mouth. Let us start with the biology because it explains everything else. Rabbit teeth never stop growing. They keep coming in for the whole of your rabbit's life, a couple of millimeters every week. In the wild, a rabbit grinds those teeth down all day on tough grass and rough plants. That constant chewing is what keeps the length in check. Nothing else does the job quite the same way. And at home, the thing that wears teeth down properly is hay. Long strands of hay make your rabbit chew side to side for hours, and that grinding motion is what keeps the teeth even. Pellets and soft treats do not do this, so when a rabbit eats less hay than it should, the teeth keep growing but stop wearing evenly. That is the quiet start of most dental trouble, and it builds up slowly over weeks rather than overnight. This is also why dental problems are one of the most common things a rabbit vet sees. It is partly diet, partly genetics, and partly the fact that the worst of it happens out of sight at the back of the mouth. Some breeds are simply higher risk. The little flat-faced ones, the dwarfs and lops, have crowded jaws where the teeth do not always line up neatly. If you have one of those, gentle regular checking matters even more. Now the part that catches owners out. The front teeth you can see, but most of the real trouble happens in the back teeth, deep in the jaw, where you simply cannot look from home. So you do not spot it by staring into the mouth. You spot it by noticing the small changes in how your rabbit eats and behaves over a week or two. The first sign is often food being picked up and dropped. Your rabbit goes for a pellet, lifts it, then lets it fall, maybe shakes its head. It wants the food, but something about chewing is not comfortable. Another early one is eating more slowly or turning fussy about the hard stuff. It might still hoover up soft greens happily while leaving the tougher hay and pellets behind. That picky shift is worth noting down. Watch the weight too. Dental pain tends to show up as a slow loss over weeks, not a sudden drop, and it is easy to miss when you see your rabbit every single day. This is where a simple kitchen scale earns its place. Weigh your rabbit at the same time each week and write the number down. A steady downward drift is one of the earliest honest signals you will get. Then there is the wet chin. Drooling from a sore mouth can leave the fur under the chin damp or matted, and sometimes the front paws get wet too from all the grooming and wiping. So keep an eye on the droppings as well. When a rabbit eats less hay because chewing hurts, the droppings often get smaller and fewer, and that drop in output is a clue worth passing on to your vet. The eyes can tell a story too. The roots of the back teeth sit close to the tear ducts, so a tooth root pushing where it should not can show up as a runny or weepy eye, often on just one side. A lump is another one to take seriously. A swelling along the jawline or just under an eye can come from a tooth root deep inside, and that is firmly a get-it-checked situation rather than a wait-and-see one. Then there is tooth grinding, and this one needs care because there are two very different kinds. A soft, gentle little purr when you are stroking your rabbit's face is a happy sound, and that is lovely. The other kind is loud and harsh and grinding, usually with a hunched body, flat ears, and no interest in food. That is a pain sound, not a happy one, and it is a reason to call your vet rather than to wait until morning. Let me put the early signs together in one place, because spotted as a group they paint a much clearer picture than any single one alone. Think of this as your noted down list. Food picked up and dropped. Eating slower or turning picky about hard food, a slow loss of weight, a wet or matted chin, smaller and fewer droppings, a weepy eye on one side, any lump on the jaw or under an eye, harsh grinding with a hunched off-color rabbit. None of those on its own is a diagnosis, and please do not try to make it one. Each is simply a flag that says book a vet and let someone qualified look properly. Now the front versus back at a high level, just so the picture makes sense. The front teeth, the ones you can lift the lip and see, can grow too long, splay outward, or curve in the wrong direction. The back teeth, the grinders, are the more common source of trouble and the harder ones to spot. They can develop sharp points that catch the tongue or the cheek, all of it hidden where you cannot see it at home. And that hidden part is exactly why this next bit matters so much. You must never trim, clip, or file your rabbit's teeth yourself, not the front ones, and certainly not the back ones. Clipping a tooth at home can crack it or shatter it below the gum, which leads to infection and far worse pain than you started with. Filing the back teeth blind is simply not something that can be done safely outside the clinic. Please leave every bit of it to a vet. So what does a good rabbit vet actually do? First, a proper look at the front teeth, which is quick and straightforward, checking the length and how the top and bottom meet. Then the part that really counts, the back teeth. A vet uses proper lighting and instruments to see the molars, and quite often a light sedation, so they can get a clear, calm view all the way to the back of the mouth. If the roots might be involved, say with a weepy eye or a lump, they may take an X-ray to see what is happening below the gum line. That is how the full picture comes together, and it is why a clinic can find what you simply cannot at home. When teeth do need work, the usual approach is gentle filing or burring under light sedation to smooth down the overgrowth and any sharp points. Some rabbits, especially the higher risk breeds, need this done on a regular basis for life, and that is completely normal. I am not going to name medicines or doses, and you should be wary of anyone online who does for your specific rabbit. The right plan comes from a vet who has actually looked in the mouth, not from a video or a forum thread. Here is the reassuring part. Caught early, a lot of dental trouble is very manageable, and the rabbit can go right back to eating happily the same day. It is the long ignored cases that get hard, which is the whole reason to notice early. Now prevention, which mostly comes down to one word: hay. Unlimited, good quality hay should make up the large majority of what your rabbit eats, because that is the only thing that truly keeps the teeth worn down. Long strand hay, like Timothy, is what you want. The stuff with visible long stems that forces proper side-to-side chewing. Soft foods, pellets, and treats are fine in small amounts, but they do almost nothing for the teeth. In our climate, there is a storage catch worth knowing. Singapore humidity turns an open bag of hay soft or musty within a week, and a rabbit will rightly refuse hay that has gone off. Buy smaller amounts and keep it sealed and dry. If your rabbit is not a big hay eater, do not swing the diet around suddenly to fix it. A sharp change can upset the gut badly, so make any shift slowly and lean on your vet for the pace rather than rushing it. Let us talk about building a checking habit, because that is what catches things while they are still small. Once a week, weigh your rabbit and jot the number down, and have a quick gentle look at the front teeth and under the chin. You are not trying to play vet here. You are just learning what normal looks and feels like for your own rabbit, so that the day something drifts, you notice it early instead of weeks too late. And pair that with a routine vet check once a year for an adult rabbit, more often for the higher risk breeds. Dental trouble is quiet in the early stage, and the yearly look catches it while it is still easy to sort out. So when is it a same-week vet visit? When the hay eating has clearly dropped for a few days, when the weight is sliding, or when you see that red chin or one runny eye start up. Those say book this week, not eventually, and when is it sooner than that? If your rabbit has not eaten at all for several hours and is sitting hunched and grinding, treat that as urgent and reach a vet straight away. In a rabbit, a mouth that hurts can quickly stop the gut, and that is genuinely time sensitive. Let me bring it all together. Rabbit teeth grow for life. Hay is what wears them down, and most of the real trouble hides in the back of the mouth where you cannot see it. So you watch behavior, not just the mouth. Dropped food, slower or pickier eating, a slow weight loss, a wet chin, smaller droppings, a weepy eye, a lump, or harsh grinding. Each one is a reason to book a vet. Never trim or file teeth yourself. Keep the hay unlimited. Build a simple weekly weigh and look habit, and let a rabbit-savvy vet do the actual checking and any work. Notice early, and most of this stays small. If this helped, the website is Singapore Rabbit. Come with a free weekly digest of practical rabbit care and a directory of rabbit-savvy vets across Singapore for when you need that dental check. Catch these things early, and your bun thanks you for it. Subscribe so you catch what is next, and give your bun a gentle nose rub from me.